So as you may know, glioblastoma is the most aggressive primary brain tumor in adults, and it is usually quite aggressive course and fatal. So for the last 20 years we've been looking at how to improve treatment in these patients. So that's how we had developed giving temozolomide chemotherapy together with radiation and afterwards as maintenance, and it was the first significant improvement in glioblastoma. So in the early 2000s, the concept of tumor-treating fields came up. Tumor-treating fields is exposing cells to an electrical field with electrical potential, and this causes polar molecules to arrange themselves in direction of the field. Now, if you start rotating the field many times, you actually have the cells or the organelles in the cells, the polar molecules, to redirect according to the field. And this has been shown in vitro and also in animal models to actually ultimately lead to disruption of the spindle apparatus and mitosis and ultimately apoptosis. In our research now, we had to design a clinical trial that would definitely show that this is working also in the clinic. So the trial I'm presenting here is on patients with newly diagnosed glioblastoma who have completed chemoradiation therapy and would go for maintenance temozolomide chemotherapy, to which we added in one arm tumor-treating fields. Patients were exposed to it continuously. So it's a chronic treatment together with the maintenance temozolomide, and we've shown that we improve progression-free and also overall survival. So we'll show here the results on all 695 patients treated. We'll focus on overall survival. We see exactly the same results on progression-free survival endpoint as well, and have been shown that we get a hazard ratio of 0.63, a 37% risk reduction in death. Or at 2 years from 30% to 43%, at 3 years from 16 to 26%, and so on. So we see some patients now chronically treated, surviving for a long time. The treatment is delivered through a device. So it's not drug, it's not chemotherapy, it's a device that delivers the alternating electrical fields through electrodes that are in patches, arrays on the scalp, which has to be shaved, chronically exposed. So we expose the brain, which is the site of the remaining glioblastoma cells that give rise to regrowth. For 10 years, the first treatment that shows beyond doubt that we have an improvement in overall survival. So in my opinion, this is now part of our armamentarium to treat glioblastoma and should be at least offered to every patient we see in the clinic.